Well, good afternoon, everyone, and welcome to this week's Fireside Chat. I'm Lisa Stearns. I'm here with Dr. Tim Cross, our Senior Vice President, and we're glad to see you today. We're glad to be back with you this week and hope everyone is staying safe and that you've had a great week so far. We will be addressing some new information about the university's plans to reopen, and we'll be welcoming our special guest today, the Tennessee Commissioner of Agriculture, Dr. Charlie Hatcher, who will be addressing you in just a few minutes. But first, you know the drill. For those of you who are new to our chats, we ask that you keep your audio muted. Use the chat function on Zoom to ask questions. You can publicly post those questions or you can send them to me privately and we'll try to get those answered for you. And of course, a recording of this session is being made and will be posted to the UTIA coronavirus website. And you can find that link on our homepage at utia.tennessee.edu. So, Tim, can you give us the latest on plans for reopening our UTIA facilities and what that will entail?
Well, thanks, Lisa, and good to be with everyone again. Really appreciate everyone taking some time on a Friday afternoon to gather together and really revisit how we're doing, what the plans are. And I think we've got a great conversation lined up today with Commissioner Hatcher joining us as well. So we'll get to him in just a few moments. As Lisa mentioned, we have taken a few more steps, and I want to make sure everyone's aware of that. So on the one hand, I could say we've got some news for you. On the other hand, the news is we're continuing to do what we've said we were going to do. So some of you might feel like this is a repeat of what you've heard before. However, I think it's important, given that we keep hearing about, reading about, and observing that cases, positive cases of COVID-19 continue to occur across the state. In our communities, I just think it's important for us to revisit, okay, what are we doing? How are we doing it? What's the plan? So let me start off by saying we've sent a message to all of our supervisors this week, and that would include our deans, our directors, our department heads, and hopefully that information is getting down to all of our frontline supervisors as well. And we've asked them to really start to work through a checklist about reopening, if you will. And I know many of you are going to say, reopening, we've been open this whole time, or we've been largely open this whole time. Understand that, but we're still moving towards in early August expansion of our offices being open, not only on campus, but across the state. Now, that still doesn't mean this is an all hands back on deck, everybody back to work just like normal. And so we're still approaching this. It's a new normal. It's a different approach, but it's one in which we want to make sure we continue to serve our students, our stakeholders, our clients, animal owners, and so forth, and continue to do so just as safely as possible and as effectively as possible. So in terms of our supervisors, we asked them to really look at three general areas for each of their units, maybe one or more offices that they're overseeing. But we asked them to think about what the workspace controls are in their office, things like seating. If guests come in, for example, where are they seated? How far apart are those seats and so forth? Look at our workstations in those spaces. How are they configured? Is there a proper distancing if someone approaches those workspaces? And prepare for additional students and or clients to be present in the future. And then importantly, our common areas, lobbies, elevators, restrooms, think about what, if anything, needs to be done in those areas. We also asked our supervisor to really think about face-to-face considerations. And I think as everyone knows, it's when we're within 6 feet of distance is when we're at the highest risk. So how do we go about managing those face-to-face interactions with customers, with students, with clients, and what can we do to really protect to the greatest extent possible all parties? We have floor signage that we can use to indicate 6 foot distances. All of you have probably been at places where you saw markings on the floor. We can certainly do that as well. Are physical barriers needed? If so, we need to really get serious about erecting those barriers, whether it be with clear barriers like plexiglass, or whether we actually need to put up physical solid barriers to ensure that 6-foot distance. So face-to-face considerations are number 2 on the list for our supervisors in terms of our workspaces. And then third, what about signage? So we've been using signage, I know, since day one of this pandemic. We've had a lot of generic messaging on our signs about distancing, masks, hygiene, and so forth. But also we need to be thinking about what about some signage in our common spaces, like the entrances, lobbies, elevators that I mentioned earlier. So all of that is really encompassed in the messaging that we sent out this week, as well as asking our frontline supervisors again to really work on developing plans for scaling up staffing, with the goal of having each office open, but also having in place a management plan so that we manage the number of customers, the number of students, the number of clients, and the manner in which we meet their needs. Is it going to be on an appointment-only basis? Is it with a queue that includes 6-foot spacing? Is it calling a phone number to then meet with a specific individual? So we need to make plans for that staffing, and emphasizing or remembering that we've always stressed flexibility, compassion, thinking about certainly our high-risk individuals, but also those who are facing challenges with school and whether students are back in school or not. So that was the major communication that we shared this week. Mr. Doug Bonner, as well as our COVID task force, was involved in really helping to get that messaging out. And I hope that then for the next week or so, we'll really be focused on taking those specific next steps in our workspaces and for our staffing considerations to be sure that we're ready for reopening in a broader sense and scaling up our presence in early August.
And we know some of our viewers here will probably have some questions, which we will get to here in a minute. But clearly the pandemic has not affected just us here at the university. It's also had an impact on our agricultural producers. Can you share your thoughts on this?
Well, I can. You've all recognized that this pandemic has affected everyone, and not just the Institute of Ag, but we're largely, as an institute, focused on serving folks, not only on campus, but across the state. And that's why I thought it'd be really helpful today to invite Commissioner Charlie Hatcher to visit with us. And Commissioner, I never know what to call you, if it should be Dr. Commissioner Hatcher or as I have known you for many, many years, Charlie. But Commissioner Hatcher, we're really glad to have you with us and share some of your perspectives about what you've seen across the state. So Commissioner Hatcher, for those of you on the call, has actually connected with the University of Tennessee multiple times over the past 3 days. We really appreciate his support. He was at the Commission on Agriculture meeting Wednesday. He was at a Mile and No-Till meeting yesterday, and now here he is with us again today for this fireside chat. So there is no doubt that Commissioner Hatcher is a strong supporter, a great friend, a great partner, and we're glad to have him with us. So what I'm going to do is ask Dr. Hatcher a few questions, give him a chance to respond, share any messages, of course, that he would like to share, and then we'll open it up, and Lisa can help work through questions, both for Dr. Hatcher and for myself. So with that sort of setup, let me just start out, Dr. Hatcher, and once again, welcome. And I wonder if you'd like to share your perspectives about what you've seen about how Tennessee farms in our rural communities have been impacted by COVID-19, and maybe a little bit about how you've seen them respond as well.
Oh, well, goodness. I've still got my Mile and No-Till hat on from yesterday, and I thought sometimes I don't turn my video on, but I figured I'd show you proof of life. I am living and well. I mentioned this yesterday, and Keith Carver was kidding me about it later on text, but my life is really all COVID all the time now. It's just that way. And that is a kind of a loaded question, but I can give you my take on it. So farmers in rural communities have been greatly impacted, of course. Before COVID, farm income was down 50% over a peak of 4 or 5 years ago already. And then we have in Tennessee, of course, agriculture is and forestry together it's the number one industry. And so I have a lot of dealings with rural communities and rural counties. And in these rural counties, it's predominantly it's one or two, or sometimes they've got a pretty good percentage of both. It's farmland and it's trees, and so it's agriculture and forestry. So those industries have been greatly impacted. But before COVID, we also had economically distressed counties by the 3 or 4 factors that we looked at: unemployment, median household income, and a number of other things. And now, after COVID or during COVID, it's almost everything's distressed. All the different ag sectors. There are some bright spots. So if you haven't noticed, there's been this re-emergence or big, huge demand for local products. If we can retain or value-added producers can retain a fraction of that demand after COVID is over, that will be a great win. This pandemic has pushed and driven farmers and foresters both to be innovative and use technology, things like drive-through pickup, contactless pickup, different software programs to help them manage their business. That's been a bright spot as well. But we have had our fair share of issues. We've had several supply chain issues. We've dealt with some of the larger meat processors had some COVID outbreaks, isolated outbreaks in some of the facilities. And we experienced in Tennessee, really not near as bad as other states, but this backlog of livestock that were ready for harvest. And we have successfully managed through that. But it does bring up the importance of having processing capacity within the state, especially meat processing, and there's other processing that we need to have increased capacity, because it's easier to pivot during an emergency like this if you have that processing facility within the state. But that's kind of hard to do with the interstate commerce that we have and the export that we have. Now, we lost a lot of export markets. Dr. Aaron goes over this when we have our ag stakeholder calls, and most all commodity prices are down. So, I say that, it's not dismal. It's just a pretty tough situation now, and we're trying our best to address it.
Good. Well, thanks, Commissioner. And you identified a couple of things there. We've all said, after this pandemic is over, there's things we've learned or things that have happened that we want to continue. And I think the notion of more local sales is a great example of a positive here, but certainly been plenty of negative things to deal with as well. So let's take it a little further then. So you've seen a lot of these challenges across the state, but I also know you and your staff have been very busy responding to these challenges. I wonder if you want to share just a few of the things that have been going on from the Department of Agriculture and your staff in response to the COVID-19 pandemic.
Well, we've been trying to stay engaged with ag and forestry stakeholders, and we've had those. We started out weekly calls, and we've gone to twice a month or every 2 weeks, and those have been invaluable to me because I learn something every time I get on those calls about what the health data looks like. And the governor was on one of the calls. We had the Speaker of the House, and it's been our attempt to try to stay in touch, and there's nothing like doing that. Now, there's been a plethora of USDA programs on the producer side to help them, and those have been going well. And Mike can brings those updates when he gives USDA update on those calls. We've always been trying to support ag and forestry businesses. So we still have ag enhancement. We did have it as of yet taken a reduction in that. We asked for an increase, and that we're granted that initially until COVID hit, and that's been taken away. But we still have that 21 million base that we have to work with unless something happens that I'm not aware of. And there'll be, a concentration of part of that to help the current economic situation due to COVID. And then we have the Ag Enterprise Fund. It's been invaluable to cost share with Ag and Forestry businesses to help them. We have that money. But in the last 6 or 8 weeks, we've been working with the Unified Command and the governor's office for some kind of program using the federal CARES money to support ag and forestry businesses. And we've come up with a plan for that. In the next week or 10 days, there should be a big announcement about that in the CARES money that's going to go in support of that. So and we intend to kind of operate that sort of like we have Ag Enterprise Fund, and it'll be an application process, and based on you have to prove a loss and a COVID expense to qualify for that. So, but it's more targeted. It's not It's not going to be a producer-oriented program. It's going to be more of a if your business didn't receive much federal funding or wasn't some of the programs that were afforded some of the business. If you didn't get some of those, we intend to try to focus on the ones that didn't get other federal funding with this federal funding. So, but we'll manage that through the Department of Agriculture. So that's a few of the things that we're doing. We had to prioritize things just like y'all did to keep our critical operations going. We're still doing our food safety and our animal testing and our feed, seed, and fertilizer testing and all that. So it's been a load.
I know you've been busy. I know your staff's been busy. I also know how helpful those industry partner conversations have been every week or two.
Yeah.
And that's been, I think, strongly valued across the state. And again, probably another example of something we might continue even after the pandemic's done, just to keep everybody in touch.
A lot of people say that. Yeah.
Yeah, very good. All right. So let me, I was going to say, take off your commissioner hat, but I don't want you to take off the mile and no-till hat, but change your frame of reference just a little bit. Many may not know on this call that you're a graduate of our College of Veterinary Medicine. So as an alumni of our vet school, as someone who's been to, on campus here at our College of Veterinary Medicine, and someone who's got a daughter that's a practicing veterinarian, I wonder if you'd like to share any thoughts or comments about how this has affected our veterinary folks across the state, both small and large animal.
Well, veterinary practice was one of the critical infrastructures identified early on, but there was some confusion whether that played over to a small animal or not, but it does, because small animals are important in a lot of people's lives, and just the health of those, you have to continue that. There was an intentional shift early on to try to not do elective surgeries, just like on the human side, so we could save PPE, so we could leave that for the human side more. That happened initially. The initial shock right away, some clinics closed down completely, others did not. Those that service livestock never did slow down. In fact, that ambulatory business may have increased in some practices. And my daughter's practice does a lot of livestock work as well. So they are currently, at least in my daughter's practice, they're currently not letting people in the office. They go out with the mask to the car and get the pet and bring it into the office to work on it if they need to. And then they do ambulatory calls, or it's a lot easier to social distance. So it's had similar impact. I know a lot of veterinary practices have seen a decrease in their practice and their revenue. I think it's starting to bounce back a little bit. And I'd say the livestock practices were less affected than the small animal practices, or the ones that were exclusive small animal. But veterinarians know the deal and know how to prevent disease. So most of them just fell right in line there.
Yeah, good. And our clinics operated just as you've described, with patients driving up outside the facility and then us meeting them there, and it's worked very well. Mm-hmm. But it's been a load on our faculty and staff at the college. They've really continued mostly nonstop since the pandemic occurred, and on top of that, trying to figure out how to do the hands-on education that's required to produce capable, qualified, competent veterinarians. So my hat's off to them for the work they've done throughout this pandemic. So let me ask you one last question, then we'll turn to maybe some questions from those on the call here today. So you're a commissioner of agriculture. You've been a veterinarian, served as a state veterinarian for years, but you're also, by virtue of the fact that you are a commissioner, you're a member of our University of Tennessee Board of Trustees, and have been really good about attending and participating in those meetings since your appointment as well. I wonder if you'd like to share any comments about your views of the reopening of our campuses. You've seen system-wide the plans and the discussions about that. Any comments you'd like to share with our institute about reopening?
Yeah, I think it's a good plan. It's very well thought out, and I do think that the campuses can safely open. There's a way to do that. I don't know if you guys saw one of those. I don't guess it was a study, but did you see where those 2 positive COVID hairdressers, did you all hear about that? Where they were positive, and they, I guess maybe they didn't know it, and they continued to operate their beauty salon, and they wore masks, and their clients wore masks, and they cut hair on 134 or 139 people, and nobody contracted COVID through that transaction. So if you're not a mask believer, you need to be, because that's, if you do, on the ag side, we talk about those procedures that prevent and control diseases, biosecurity procedures, and it worked very effectively for us, or my previous life as a state veterinarian. So mask and washing hands and social distancing and all that is the way we can control, or at least try to lower the risk for that. So I think we can do it safely. That's not to say if you're a high risk person, probably you need to stay isolated most of the time. I've got a 82-year-old mother-in-law on our farm campus here, if you will, and we do our best to try to protect her. She doesn't go out much at all. So, yeah, I think it's being done right, and I'm supportive, and I think it's going to be at least a good way to start.
Great, thanks, Commissioner, and I agree with you. We've got some pretty darn complex guidance and rules that we're developing at the state level, at the university level. But when it comes down to it, it's my opinion, the really simplest things is what's the key. Washing your hands, cleaning your workspace, wearing a mask, staying 6 foot apart. And thanks.
The shaking hands thing, and I missed that part of it, but I guess that'll keep us all healthier. We may never shake hands again, you think?
We may not. I don't know. Dr. Beal was saying the other day she likes to hug people, and I told her she better get over it.
Yeah, that's over with. Yeah.
For the time being. All right. So with that, Lisa, do we have any questions for Commissioner Hatcher?
We do, Commissioner. Here's a question for you. We've been hearing that there is a 1-year waiting list for processors to process local produced beef. Is this just a short-term issue, or is it a COVID-related issue, or do you see it as being a long-term issue?
Well, it's a little bit of both. I mean, COVID certainly affected and emphasized it and showed our deficiencies there. But it's a longer term issue, and we're focused on it. So we've had, I think Wendy Sneed in our department, who's our meat specialist or beef specialist, she's had 21 or so people interested in opening small processing facility. And within this proposal that we've submitted for the CARES package, we've tied it into the food supply. And so we think we're going to be able to use that money to buy refrigeration equipment, freezer equipment, and infrastructure required to expand or put in newer existing small processors. And a matter of fact, a couple other states are doing the same thing. So North Carolina and Oklahoma and Tennessee are going to be going down that path because it's a national phenomenon. Yeah, I'd say some of those are over a year wait. So I challenge you to get an appointment to harvest an animal in the next. It's hard to do. So, it's a long-term deal. We're working on it, and hopefully we'll have. We're going to concentrate on that from Ag Enterprise Fund and this new Ag and Forestry COVID relief program that we're going to roll out.
So this question actually, both of you could answer for your respective areas. This person is asking about the use of face shields as opposed to face masks. Do you see an advantage to that? And if so, like where would you see that?
You want to address that first, Tim, or?
I'll probably address it by saying I'm confused about shields myself. I can see some advantages to shields. I know that the university is really focused on making shields available, but I've also read that if you don't wear a mask along with the shield, it's really not a great advantage. So I'm going to need some guidance from some of our public health experts on shields, I think.
Yeah.
If it makes good sense, I'm for it, but I don't understand why we wear a shield and a mask at the same time. Seems like that's even more intrusive and less comfortable. So, Charlie, I don't know what you've heard about it.
No, I've heard the same thing. It is kind of confusing. You know, if you didn't have to wear a mask and a shield, then you could at least see their lips or see their face. I mean, some people I don't even recognize with the mask on. Have you noticed that?
Yes.
Anyhow, so I think there was I know that there's been some shields used in meat processing, and I guess the idea behind that is protect the eyes as well, because you could absorb things through your eyes. That would be helpful, but for just a regular person, I can't see it. But then again, I mean, we're using plexiglass, at registers and where you have that, and I think those work well. I went to the co-op a month or two ago, and they had their whole service counter enclosed, and I think that's smart. So, I think there's a place for it, but I don't know where exactly.
You know, one of the things I do is say, I don't know, but we got people that do know. And
yeah.
In our chat, Dr. David Anderson has a thought or two. David, you want to share with the group just a little bit of your perspective on this?
Yeah, I think it's just addressing the two modes of transmission. And so we know that the principal reason to wear a face mask is to keep you from contaminating the environment so that you're not exposing other people. The shields, whether it's a face shield or a workstation shield, is to help protect you from other people, especially if they're not wearing a mask. And so it's a two-layer protection to try to catch the road that's going in both directions.
Well, that makes good sense. Thank you, David.
We are so lucky to have medical professionals because they've also shared that you have to remember masks are not 100% effective. And so that's why social distancing also plays a role in this. So we do have a few questions, Dr. Cross, that are coming your way. One is that in the last couple of weeks, we've seen the data show that local numbers are all trending upwards and at an increasingly fast rate. How do we reconcile that data with plans to come back on campus?
Yeah, I think you could generalize that question not only to plans to come back to campus, but plans to send children back to school and plans, for continued ramping up of employment across the state or across the country. So I see the data. I actually agree with that and ask myself the same thing. I do believe we've actually seen a bit of a leveling off the last 3 or 4 days, but as Commissioner Piercy and many others would say, don't look at 1 or 2 days data. You've got to look at longer term data. So I'm certainly not going to say, oh, don't worry, it's leveled off. I don't know if it has or not. But I think the other thing we're starting to realize is this thing's not going away tomorrow or the day after or the day after. We're in a long-term battle here. And I think short of saying that we're going to stay locked in our homes for the next 3 or 4 months, which I don't think anyone wants to do, we've got to figure out, and I think we have figured out some ways that we can safely manage and cope with the coronavirus, recognizing there's going to be positive cases. But if we do everything we can to prevent reduced transmission, and to avoid catching it ourselves, I think we're part of the solution then, even as we ramp up our offices being more accessible, and as we ramp up education for students back on campus. And I'd also say, when it comes to coming back on campus, remember, we're not going to be conducting lectures to 250 to 400 students in one room. We've adjusted social distancing. We're making sure that there's proper hygiene for sanitizing before and after classes. We're making people self-screen so that if you're feeling ill, if you've got symptoms, you're not to come to campus, not to come to work. So I think we have procedures out there that certainly require cooperation, certainly require good behavior on all our parts. But if we'll all do our part, we can continue to move this direction and do so with a minimum of risk. There's nothing that's totally certain in this world. And I don't know that we can be absolutely certain that we can cross the street tomorrow safely, but we can do so wisely, and we can follow practices, whether it be COVID or anything else, that give us the very best chance of staying safe and staying healthy. And on top of all that, then I come back to what the commissioner mentioned, and that is, but if you're in a highly vulnerable, high-risk category, you should stay isolated. You should stay working remotely, and you should work with your supervisor to make sure that's the case. Commissioner, I'll just ask if you want to make any comments about the increasing number of cases and how that impacts our reopening.
Well, I think your comments we're recording this. I might use your comments later. Yeah. But I find myself, I go to the Department of Health's website every day and do the positivity rate. If you look at the positivity rate, has anybody looked today?
No.
But it's I wouldn't let the number of positive tests scare you, but you need to look and see how many tests were run. So we've been running, I know we went from like 5, we jumped to 8%, and then a couple of times we jumped up to 10 or 10 point something. The last couple of days when I checked it, it was about 8.5%. It might have hit 9%. So, Florida hit as high as 20. So I think the positivity rate is something we need to watch. But I agree with you. I mean, we have to follow all these procedures together to do it right, and including the face coverings and hand washing and social distance and all that. But I do think there's a safe way to do it. But you got to protect that high risk group, and you're right. They have to work that out through their supervisor, and that can be done, because it just wouldn't be smart to put an 82-year-old with diabetes out in the general public with or without a face mask. But another comment or two. As part of that economic recovery group, we had to open the economy on a limited basis. I mean, it was on life support. It was fixing to be a total economic collapse. I mean, I know there's some that say, well, that's not good to open things up, but we tried to do that safely, and I know we've seen this latest trend to go up. But another thing you have to look at too is your healthcare system. We surely are not going to do our best to have some headspace and keep some headspace available. I think if you see that beginning to max out, then you're going to see some more action taken. I know some of the hospitals are already not doing elective surgeries, and that'll help in that respect. But because the last thing we want to do is take away that healthcare option, then you would have more people dying. We're not going to do that, or I hope we don't do that. So we'll take different action. But we have to. There's risk. We can limit the risk, but we can't eliminate it.
Thanks, Commissioner.
And in some ways, you're exactly right. We got to learn. We had to learn to live with it, because you're right. I don't think it's not going to be business as usual until we have an effective vaccine. Do you think?
I agree.
The days of mass gatherings and things are over until that happens, and then you've got to worry about. And what I worry about is the next one. I mean, there's already in my previous life dealing with viruses and bird flu and swine flu. there's talk of another swine flu mutation that could affect another pandemic. So we're working with, also going to submit a proposal to the governor's office on the One Health concept is really right on spot now, because we want to be able to do some human human COVID testing at our lab to run as overflow for the health department, because they need some help right now, and we can provide that.
Very good. Yeah, I think both at the state level and at the university level, the move to really ramp up One Health work is
Yeah,
well timed. Maybe 10 years too late in some respects, but boy, no time like the present to ramp
right.
up further.
So, in thinking about cases rising and this continuing to grow, Tim, in particular, what would it take to change your mind about opening or keeping open the campus? And is there a plan for potentially closing if it did get out of control?
Yeah, we've actually talked about that among the chancellors, President Boyd, and it comes right back to something Commissioner Hatcher just mentioned, and we really think key would be our healthcare capacity, availability of hospital beds, availability of ventilators, availability of bed space, and emergency care, ICU space. Those in particular, if we can't treat cases, then it's really a dangerous situation. If there is that capacity, we've got a better ability to respond to a positive case should it occur, and should it require really in-depth treatment. So I think that would be first and foremost. Secondly, I don't think it's not going to be an independent decision. I think for the Institute of Ag to declare we're going to close and Knoxville remain open is not going to happen, and vice versa. So I think we'll coordinate very closely with Chancellor Plowman and her staff, and also, of course, make sure the president is on board with whatever decision might need to be made as well. So I've said before, it takes months and months of planning to get ready, but changing course and declaring, we're going to go a different direction and everybody work remotely again, that, as we've seen, can happen very quickly. So I'm sure not indicating that could never happen. It could, but I think we're continuing to plan and move towards reopening with the notion that we've got to do so safely, but we've got to serve the citizens of the state, we've got to serve our students, we've got to serve animal owners, and carry out our mission as well.
So there's a question about our facilities that are off campus and visited frequently by customers and clients. And there's still concern about just how effectively those restroom facilities will be cleaned. Is there some way to maybe set up porta potties or some sort of facility bathrooms that employees could use? At least that would take the the use off of those facilities and have them available for clients.
Well, that's a great question, and that may be the first time in my career that I've had someone suggest they would like to have a porta potty. But I understand the logic or the thinking there. If we've got commonly accessed public areas and we're not sure to what extent they're really being sanitized, I get it. So I understand. This is probably one of the most challenging areas for us because we are so dependent on our partners, whether they be county government or others, for providing our space. And that partnership means that we get the space, but as the owners of that space, others control and manage much of how the space is managed. So that creates a real dilemma for us. I think those kinds of situations are going to have to be tackled one by one. I think if it's a county office that we're talking about, for example, that warrants a discussion with the regional director. If it's a rec facility, I think that warrants a discussion either with the rec director or with Dr. Shin's office. So I don't know that I can give any blanket recommendation here other than to say, as I've always said, if you have concerns, let us know specifically what they are, and then let's figure out how to address them. And that is, I think, the best approach to a facilities challenge like we've described that I have, and I'll commit to helping any way I can. If it's a matter of needing supplies, or if it's a matter of an alternative restroom facility, surely we can figure out how to do that and make it such that it's healthy and comfortable for those that are working there.
And one follow-up to the 4-H comments. This person is asking, is your recommendations for all events or just UT 4-H events?
Recommendations for all events.
As far as just self-isolating or not having to just.
Yeah, I think that goes for any event or any activity, any meeting. If you've been at some group gathering, and again, unless you know you've had, as Dr. Hatcher described, prolonged direct close exposure, there's no reason to immediately self-isolate. Now, if you're exhibiting symptoms or otherwise concerned about your health, that's another matter. But simply attending an event and then being required to self-isolate is not what we've been recommending.
So we do have a question about traveling to a hot zone. Is that still a requirement that we need to self-isolate?
Again, I think we need to be smart about what we're doing, and it depends on the nature of the travel and how that's being approached. So if we're going to visit a family member in Los Angeles, but we're driving there, I don't know why we would, but we're going by private vehicle. We're going straight to a family member's home. That family has no positive case. We're coming straight back to work. I don't see that would warrant a required self-isolation. If we're staying in a hotel in Los Angeles and frequenting many public places and interacting in entertainment venues and so forth, and I'm picking on Los Angeles, but just as an example that I think everyone knows is a hot spot. If we're visiting a hot spot and doing more of that sort of public interaction, I think that warrants consideration as to whether it might be a requirement to self-isolate. And I know this puts a lot of burden on our supervisors, but I think that's going to have to be a conversation with the supervisor and agree what's best for the employee and for the unit in which that person works.
So we have a question regarding printed guidance for starting up with UT campuses and our K-12 schools. A lot of people do have students that they are having to negotiate, either keeping them home or sending them on to school. So the person is asking just what's expected of faculty, staff, full-time and part-time workers as far as coming back to the workplace.
Good. And again, I'm going to put some of the burden on our supervisors, but we've said our offices need to be open. That doesn't mean every person has to be in the office every day. We can work out a schedule, and I hope we can work out those schedules such that if a family has children and they say, I've got to at least be able to take my children to school or provide care for them in the mornings, but I'm available in the afternoons, we need to be flexible and work with individuals like that. But we've got to be cognizant of treating everyone fairly. So I don't think it's a matter that we can say anyone with children doesn't have to work. And I also don't think we can say because anyone's younger, they have to work. We've got to look at this from a matter of fairness and equity. So it's going to be a judgment call, certainly, and we can have our human resources staff assist if need be. But let's try to work within each of our offices, determine what the personal challenges are of our employees, but then figure out a way that we can also work together to conduct the programs, do the research, provide the teaching, provide the clinical service that we need to do in order to serve the state. So, Commissioner, I suspect you've probably been asked some similar questions. Anything you'd add, or you may want to disagree with what I've shared?
No, I agree with that. I'm just sitting here thinking I'm glad you're getting all the hard questions. but you know, but really, I think I think you're right. You got to use some common sense on this. See, I referred to this before. I live on a farm here, and there's 8 families that live on the farm that are hatcher influenced. And my mother-in-law lives in a house by herself, and she's 82 and got some health issues. So we're in close contact with her a lot of times, and with the grandchildren. So, I mean, I'm as careful as I can be. I'll go downtown. You know, that's a hot zone. Nashville's a hot zone. I'll go downtown, but I've got a mask on. I'm distancing. I'm not eating food with anybody. And then I go to that meeting and I get out. But it does make me a little bit nervous. I think you still have to be as careful as you can and do a combination of all those. But I'm sure everybody has a similar concern, you know, somebody in the family that's high risk. You know, most of what we found, at least within our department, we've been following, or the employees been following guidelines as close as they can. If they count, we've had a number of, I'd say less than 12 or 15 out of 800 employees with COVID. And usually that's come from, it hasn't come from being at work or working from home or any kind of our activities. I suspect the same way would be for your people. Probably going to get it from a relative that's got it or doing something that I don't know, or exposure to, I don't know, to close contact with somebody, or they didn't know it, you know.
Yeah.
So we have what it looks like one more question, and it's asked, this person is wondering if there's any guidance on 4-H school club implementation this fall.
That's a good question, and I think that's going to be really hard to do statewide, given the fact that every school district is pretty much making their own decisions about reopening, going online, doing some combination. I have not checked to see if maybe Mr. Justin Crow is with us today. Justin, if you're on, would you like to speak to that? I'm looking to see it. I don't see Justin Crow with us, so let me just suggest, Lisa, we get back to that individual with regard to that question, and maybe that warrants you know, a broader message to all of our 4-H staff. So good question. I'm sorry I can't answer more specifically. Oh, and I think I just see Mr. Crow on now. Mr. Crow, you want to comment about conducting? Whoops, I think he dropped off again. I don't know. Justin, are you on? All right, we'll get back on that one.
We'll get back. And just a reminder to everyone, if questions come to mind, you can enter them at the coronavirus website, and we do try to get back to people as quickly as we can on those questions.
Lisa, can you all hear me now?
Ah, there he is.
I'm sorry, I had hit the wrong button. So we are working diligently to address that. We know it's a real need. We've appointed a fall programming think tank that's putting together some best practices and recommendations. They are working diligently to have some best practices. We're looking at things like Google Classroom, for example, to be able to engage with young people. Dr. Senseman and I talked earlier this week. I'm trying to put together some resources for agents in particular. You know, for example, if they're asked and invited to come into a school, that will allow them to come in, but they have concerns about that. We're trying to put together some guidelines, some talking points. So we've got a whole team working on it. Their deadline is this next Friday to have all that information ready to go out. So more details are forthcoming.
Great. Thanks very much, Justin. Sorry to put you on the spot there, but appreciate you letting us know what's going on. I just saw Lori submitted an answer as well. So thanks to both of you. And I see Dr. DeNovo says we're actually using porta potties right here at our College of Veterinary Medicine as well. So that's a great example of being creative and addressing a need. So thanks, Dr. DeNovo.
Awesome. Well, Tim, I think you're off the hot seat at this point. So do you have any final comments?
Well, let me just say, we're all on the hot seat, you know, to some extent, because we're all being looked at as leaders. We're all being looked at to set an example. We're all expected to provide answers, whether it be at home or in our communities. So, yeah, I might have had to field a few of these questions today, but I know each and every one of you has to field questions too. So let's be the positive example that we can be. And I keep harping on this, but I do think the only way we can really be successful in managing through this pandemic is with the simplest of things: washing our hands, cleaning our workstations, wearing masks, keeping distance from individuals, staying home when we're sick or think we might be sick, reporting if we are showing symptoms. Those are the things that are going to make the most difference. All the rest of the guidance and restrictions and rules that we have in place are really based upon those simple practices happening. And so if those don't happen, none of the rest of it really helps us a whole lot. So I'm sorry to be a broken record on that, but that just has to be our commitment. And it really, that reminds me that several weeks ago, we had a training that we offered about how to successfully and safely return to work, if you will. I actually, had forgotten some of that and went back and watched it myself yesterday. That training remains available on Kate. And so if you go to Kate and just type COVID-19 in the search, you can find that again. You may want to get a refresher too. It's still out there and it's still very pertinent and relevant. I know our faculty and staff are continuing to be really innovative and meeting needs, delivering programs. Yesterday's kickoff of the Milan No-Till virtual field day, I think, is another great example of how we've been able to keep everyone safe while also conducting one of the major field days that we do every year or every other year in the case of Milan. So keep up the innovation, the creativity, and keep yourselves safe. I want to again say a special thanks to Commissioner Hatcher and all the staff at TDA. We've got a really close working relationship with the Tennessee Department of Agriculture, and I really see how that benefits our organization, and I hope the Commissioner feels the same way. We appreciate his personal support and the department's overall support and partnership in so many ways. And I'll just give Commissioner Hatcher, if he wants to share one last word or thought, now might be the time to do it, Charlie.
No, I agree with that. And just right back at you. I mean, the relationship we have with UTIA is tremendous, and it needs to be that way. And agriculture and forestry is number one, and we want to keep it that way. And this too shall pass at some point. But we've got to get better and better and follow those simple biosecurity procedures, as I like to call them, and there'll be a vaccine at some point.
I agree. Well, let me wrap up just by saying, if you'll think back to the very first one of these fireside chats, I mentioned that, I chose that name because I looked back and thought about Franklin Delano Roosevelt and how he felt like it was important to communicate during a time of war. And, we're still in the war, but I do think we're making progress. So we're not ready to declare victory, that's certain. But we're out there fighting this war, and each of us can do our part and should continue to do our part to really keep everyone safe, keep the risk of transmission as low as possible. So thank you for all that you're doing. Thank you for your commitment to the Institute of Agriculture, to our students, to our rural communities, to our animal owners. Appreciate the work that you do. And I hope each of you have a great weekend. So with that, I'll conclude and turn it back to Lisa to wrap up here.
Thanks so much, Tim. And thank you, Commissioner, for being with us today. We really enjoyed that. And yes, I'll echo Dr. Cross. Everybody have a wonderful weekend.